In this video, we will cover superior vena cava syndrome. We'll talk about the definition, its etiology, diagnosis, and management. SVC syndrome is the partial or complete obstruction of blood flow from the superior vena cava to the right atrium. It can be caused by vessel compression, invasion, thrombosis, or fibrosis. For etiology, malignancy accounts for up to 90% of cases, being non-small cell lung cancer the most frequent. Some other malignancies are small cell lung cancer, lymphoma, and metastatic lesions. Thrombosis of indwelling central venous catheters or pacemaker leads can also cause SVC syndrome. The most common symptoms include facial or neck swelling, arm swelling, and dilated chest vessels. These are examples of facial plethora and engorged veins. Patients may also present with the Pemberton sign, where within 30 seconds after raising both arms, the patient will develop facial plethora. Symptoms can mimic congestive heart failure, pericardial disease, presenting with cough, dyspnea, and orthopnea. Sudden onset can cause increased intracranial pressure, cerebral edema, intracranial bleeding or thrombosis, and death. For diagnosis, we will get a contrast CT chest, head and neck, an MRI if CT is not available or is contraindicated, and venography for stent placement or if surgery is planned. The management will be directed by the severity of symptoms. If the symptoms are life-threatening, meaning that there is airway obstruction, hemodynamic instability, or altered mental status, we will get a venogram and an urgent stent placement, and we will thrombolize if necessary. If the presentation is not life-threatening, then we will get a biopsy to guide therapy. We will use steroids if the airway obstruction is not amenable for stenting. For example, we can prescribe dexamethasone 10 mg IV once, followed by 4 to 8 mg Q6 hours IV or PO. Steroids will also be used in steroid-responsive tumors such as small cell lung cancer. Stent will be used for symptom palliation. Radiation therapy will be used in non-chemosensitive tumors such as non-small cell lung cancer and mesothelioma. And chemotherapy will be used in chemosensitive tumors such as small cell lung cancer, non-Hodgkin lymphoma, and germ cell tumors. So in summary, SVC syndrome is the partial or complete obstruction of blood flow from the superior vena cava to the right atrium. The most common symptoms are facial or neck swelling, arm swelling, or dilated chest vessels. For imaging, we will get a contrast CT head, neck, and chest. The management will be guided by the severity of the presentation. It will include a venogram for urgent stent placement in those cases that are life-threatening. And it will include a biopsy to guide therapy for those that are not life-threatening.